Hi, everybody. Good afternoon. Welcome to the eighth episode of the Health System Fix podcast. My name is Dr. Gaurav Mishra. I'm a child, adolescent, and adult psychiatrist and a health systems expert. I enjoy talking to people who have expertise within the health system space, in mental health space, and coming at it from many different angles. I'm really excited to welcome Dr. Bhargav Patel today. He's a multidisciplinary physician leader, an entrepreneur, and an innovator. He's currently a research track fellow in Child and Adolescent Psychiatry at Brown University. His research is on developmental trauma and its implications on early biomarkers of aging. He's also publishing a book called Trauma Transformed, Your Guide to Understanding Trauma, Resilience, and Post-Traumatic Growth. Also an entrepreneur. He's a CEO of myPEAK, an award-winning vegan health company. He's also a leader in the AI healthcare space, where he has been the chief medical officer at Sully.ai and currently is on the clinical advisory board. Outside of work, he's an avid reader, meditator, yogi, and hiker. And he's also working on visiting all the 63 U.S. national parks. So a lot going on. Welcome. Great to have you on.
Great to be on, Gaurav.
Great. So Bhargav, maybe you can tell us a little bit about what was life like before you went to college?
Yeah, definitely. I've lived all over the place. I moved around a lot in childhood. I was born in India, technically, because my parents were visiting at the time, even though they were living here in the US. But then I came to the US after and have lived across Georgia, New York, New Jersey, Michigan, several different areas across the board. I think I spent the most time in Georgia, which is where I did high school. So most of my time has been in the South. I went actually to Vanderbilt in Nashville for undergrad, so stayed in the South also for medical school and residency. And now I'm currently up at Brown University up in the Northeast for Child and Adolescent Psychiatry Fellowship. But early years, I did a ton of different things. I was really into sports. Most of my middle school, high school days went in playing sports. That was, we'd get home from school and we'd be playing football and baseball in the neighborhood. So I was a big outdoors person, and that's evolved over time. Now that it's harder to get sports together, I've changed it to hiking.
That sounds like a fun childhood. When did you start thinking about going into healthcare and medicine?
Unlike most people, or unlike most Indians, I started out college actually not pre-med. So I was not necessarily intending to go to medical school. When I was considering doing economics and pre-law at the time, but I actually took a bio class my first semester of college, and I absolutely loved it. So I actually switched to become pre-med, especially the genetics aspects really intrigued me. So that was the original inspiration. I stuck with it. I actually ended up majoring in religious studies and philosophy in college. So I decided to explore different things, different cultures. So that was my major, but I did end up doing the pre-med and going to med school from there.
I would love to explore, the major in religious study and philosophy. And how do you think that has impacted your experience of the medical training and maybe the work you do today?
I think it's really enriched it. I think studying different cultures from around the world really broadens your perspective and gives you the frameworks for how different cultures, different groups of people may think about the world and may think about the process of healing and the process of recovery from illness or the nature of illness itself. I think there's a deep, often religious or philosophical or cultural aspect to that. And having explored the various cultures, I wouldn't say I know them perfectly, but I had a perspective from which to explore them with the patient. And so I think it really enhanced my journey
Right.
through medical school and my work today as a psychiatrist.
Could you give us an example of a patient interaction that you feel really brought those two learnings and experiences together and made it concrete?
So I think there's been many over the years, some that stand out, some that are more subtle, where you just have a subtle perspective on people's perception of illness. For example, I had a patient that was Buddhist, and their perception of why they were dealing with this illness was tied to karma, and they conceptualized their illness as an illness of karma. And, normally medicine would just not necessarily know how to deal with that. But, really getting to talk with him on what he felt that karma was and what he felt like led to the illness, not only had him open up to different options for treating the illness, but it also led to him opening up a perspective that we could explore in therapy as well for what are some of the things you're struggling with, what are some of the things you're feeling. So I think it's been incredibly useful as a psychiatrist.
I think the openness you can have to a different experience that is not in our psychiatry textbooks. With that, training is definitely unique. Tell us a little bit about decision to go into psychiatry and what drew you to the field.
Core reason I went into psychiatry was that I really love neuroscience and the nature of human consciousness. Probably going with the stream of exploring religious studies, philosophy, all those things. I've always been interested in the deeper philosophical questions, and a great place in medicine where it felt like I could do that was psychiatry. Also, in the research side, I do love the neuroscience aspects of research. It's always the things I love to do. In high school, I read my psychology textbooks for fun, loved the neuroscience sections. Because I was really just curious on how we think, why we think, or how all of that works. And so that really sent me into med school with the natural either I was going to go into psychiatry or neurology. Those were the two options I had based on what I loved doing. And I ended up choosing psychiatry because the aspects of neuroscience I was most interested in was actually how it influences our feelings, thoughts, emotions, actions. And so that's what I would say my path to psychiatry came from.
At what period in your journey did you think about an MBA and get your MBA?
So I've often thought about getting an MBA. Even when I was an undergrad, I had run a little business or two in high school. And then during medical school, I actually started a vegan nutrition company, myPEAK, which is still running today and doing well. So it was always there. I made that final decision during residency. I'd often thought I could wait till after medical training, but medical training feels like it goes on forever. So I was like, it's time to just do it. So I actually did it on the side through University of Arizona. They had a really flexible program and great healthcare curriculum. So when I really got interested in how the system of healthcare works, that's why I decided to do the University of Arizona MBA during my second year of residency, because they had pretty extensive curriculum on how the healthcare system works.
Yeah, the health system is definitely my key area of interest. That's part of the reason I got my MBA also. Looking at yourself and other physician leaders who also have an MBA, what do you think each of those lines of training offers?
So I think it's been incredibly valuable. It's not the exact specific sitting around doing accounting or something like that, but it's really understanding how these things work. So when you're focusing from the physician perspective, you're often really focusing on the science, the facts, the memorization, the medical decisions you have to make for the specific patient in front of you. So it's a one-to-one, bottom-up approach. You essentially are treating one patient at a time and doing that work. But then the MBA really provides that systems approach, so that top down approach where you modify those systems and they have ripple effects throughout a health system, throughout a business, throughout an organization. And those decisions can make impacts far beyond just that one patient you're seeing. And there's merits to both sides, but I think those perspectives are incredibly valuable together when you've both been a clinician and you understand the business side, especially as a health systems leader or really anyone having a perspective in healthcare, because as we all know, like healthcare it's a massive industry. It's a business component, there's a service component, all of that exists. And really navigating that, it really helps when you have that MBA perspective.
Physicians are taught to have a lot of confidence in our decision making and diagnosis in school. And unfortunately, sometimes we believe that we have that same expertise in all fields, which we do not. And I think that just that investment of time, time in the MBA or just learning to be a better leader goes a long way in being able to do good work.
Definitely. I think the challenge is like physicians are smart. So it feels like you can generalize your intelligence to anything. But just like with anything else, you still do need to understand the field to use that. You can be intelligent, but it still takes the knowledge of that area.
You've talked about psychiatry. How are you thinking about AI in the perspective of psychiatry, child psychiatry at this point?
With psychiatry, often we're hearing things about, these chatbots where people are using chatbots as their therapist. They're using these chatbots just to have someone to talk to for loneliness. And I'm not going to make any judgments on whether it's good or bad. I think it is what it is, right? And we have to put appropriate guardrails on it. We've seen some bad cases where, gave people ways to commit suicide or other things of that sort. But there's changes happening. For example, OpenAI recently released parental guardrails, and where it would even notify parents if people were asking about like self-harm or anything of that sort, and is putting more and more guardrails in place. So I think it's just important as AI is evolving that we think very mindfully about how we do it. Can AI be a useful tool potentially for therapy? Absolutely. I think, will it be as good as a real therapist? Maybe, maybe not. But I think that's not really the question. We already have such a shortage of mental health providers across the country and across the world. There's so many places where it's impossible to see a psychiatrist or a therapist. So is the question sometimes is having something that's good better than having something that's perfect? And I think that is part of my perspective on medicine in general. We often think to the gold standard, which is important. We need to keep pushing that gold standard forward. However, that's not always accessible. So if we can't give someone 100, should we just give them 0? I think there's a healthier in between where we can access, even if it's 50, it's better than 0. So that's how I tend to think of it. But other areas for AI and psychiatry, I think there's a lot of areas. AI voice analysis, where some of these voice patterns and the tone and all of that can potentially indicate suicide risk or impulsivity risk and those kinds of things. I've seen those tools in development. So I think there will be a lot of that over the next decade that really advances the field, as well as AI for drug research, for neural pathway analysis. That way we can really identify more precision, like which medications could work for specific people rather than just a more general of we try different ones.
Many people do not have access to any care. And a lot of the similar arguments I feel were made when we went from in person only to tele also, that this is not as good. We should not be doing this. But the fact is, there are people in rural areas, but there are people in urban areas who have to take a bus to get to you, may lose their job. And there is significant advantage of being able to offer treatment, which may not be the gold standard, but is close to as good.
Telehealth is just, it's a game changer. People have jobs, people have kids, people have restrictions around work, people have transportation issues. We often, when we think of these gold standard ways of doing things, are really catering to the privileged, but there's so many people with so many obstacles that we don't know. And I think it really makes a difference to have things like telehealth. It was the same argument. And I think it's broadly increased access around the country. And so I think even if it's not perfect, yeah, it may not be the ideal thing for every single condition or illness. But at the end of the day, is someone getting care that's 90% as good, better than them not getting care? And most studies, I mean, to be honest, most studies on telehealth show it is just as good and just as effective. But there's theory, there's ideas that, oh, maybe in-person care is better. And maybe for some cases.
We forget that in-person care is not perfect either. Could you tell us a little bit about your role at Sully.ai, other organizations you worked with in the healthcare AI space? How did you first get into the work and how did it evolve?
Yeah, so I mean, I have a tech background, not to the point where I'm not going to sit around programming anything. I know how to program, I suck at it, but I know how. So really a lot of interest and literacy in the tech space. I've done a lot of work with AI related things. Actually, currently working on a book on the future of AI in healthcare. And so several things in process, but I originally got involved with Sully almost 2 years ago and initially was a consultant and then later medical director for almost a year and then chief medical officer for a while. And we built a lot of great products out there. It started out as one of the ambient scribe companies and really expanded to a full suite of AI employees or AI agents for healthcare, whether it was AI receptionist or an AI scribe or all those different tools. And I think there's a lot of companies out there doing similar things today. And the race is pretty fierce. There's intense competition. And even with Epic getting into the space recently with all their AI tools. It'll be very interesting to see how all that plays out over the next few years and over the next decade. But I think AI tools have an incredible potential for reducing physician admin burden, improving patient care, reducing both diagnostic and treatment errors, and so much more. It's not going to be a fix all for everything. I think there's a degree of overhyping of AI that certainly is happening today. There is a little bit of a bubble, and I think there's some honest truth, and there are some good things about AI that will make a big impact. But I do think some of the more extreme overhyping leads to even more distrust on the other end, because there is areas where we're overhyping what AI can actually do.
When you think about problems in healthcare that need solving, obviously physicians and healthcare workers being able to type their notes on time and not having pajama time, which is sounds fun, but it's not. Physicians spend hours every day at home typing their notes after kids go to bed. And so that's obviously a high burden problem, right? And then you can talk talk about another example of a patient who has complex social determinants of health factors, is unhoused and or lost custody of their children. Are these two problems in healthcare, when you think about perspective of AI potentially impacting them, are they similar or are they really different? I feel like they're different problems and different scales of difficulty.
I think they're definitely different problems, but can AI make a difference in it? So I think when we think of the current generation of AI tools, they're systematic transformations. So, how we went from having no electricity to electricity, no internet to internet. Like those were systematic transformations, and these are fundamental technologies on which layers are built on top of. So I think this current generation of AI tools is a new operating system. It's a new layer of technology. It's a new transformation of civilization. So the same tools will have the ability, when specifically organized and built for those things, to impact all of these. The issues may not be the same, but the foundation for what tools can be built on top of is.
The ambient AI solution, it's for the most part generalizable to most health settings. If you think about an AI solution which is serving case management, I'm in San Diego, where Hawaii, a very rich area of town, and then there are other areas of town which are underserved and poorer in socioeconomic status. A case management tool that is trained in one area may not serve the other area well. Do you think down the road there'll be more geographic specialization of an AI tool?
I think you highlight a really important point. I've never been to San Diego before, though I am going in a month for the first time for the AI and Medicine conference, which is in November. So I will definitely reach out. I think it's a very important point, and there's a lot of things to unwrap in that with the data that these AI tools are trained on. For example, if you train an AI tool on a certain set of labs, it's going to adapt its knowledge based on that, right? So it may not be the same when you're treating patients in Beverly Hills versus when you're treating patients in more underserved areas. And that data may not always apply. For example, a lot of our normal lab ranges are based on white male studies. And so that if we're training things on that data, it will be biased and not apply to every group or every area. So I think that I don't know how exactly we'll go about it. There's many approaches we could take, right? But whether it's fine tuning these models for specific areas or building more individualized machine learning models for specific data sets in specific patient populations, those are certainly ways to do it. It'll really depend on how things evolve over the next few years because, of course, the generalized models will not apply to everywhere, every place, every time. While they can give useful general knowledge, then the applications built on top of these foundation models, which will serve as a foundation, will have to be tailored and personalized to different areas and different populations.
Right. What potential do AI tools have in helping improve patient, physician, or healthcare worker relationship, or patient's relationship with the health system in general?
I think that can be one of the best things they can do for patient physician. I mean, obviously, most people have experienced this at this point. Like their doctors have no time. They're spending all their time looking at the screen, typing stuff up and putting in orders. So it feels like it's destroyed that presence between patient and physician. Ambient scribing tools can make a big difference. They can write that note so the doctor's not stressed about that. They can put in some of those orders. It can really help reduce that whole burden and bring that presence back into the patient-physician relationship, which I think is a game changer. And I think that's one of the first benefits people will see. And then other toys, I mean, with the health system, just more AI care coordination and just smoothing out that whole care journey process would really make a big difference. There's AI voice agents today that really it's difficult to tell that they're not a human on the other side of the line and they're actually intelligent and can help you, schedule your appointments or do other things. And I think it'll just improve that interaction with the health systems, hospitals, clinics. It will just make it a smoother process, make things more organized. and really improve access across the board.
Been having a disclaimer saying that I'm an optimist in many conversations recently, but I am. And let me ask you, I've seen in many situations that as we have something that makes it a little bit better for the experience in name of efficiency, oftentimes there are pressures that a fear I have is once we remove all of this burden off physicians, are physicians then going to be told, why don't you keep seeing your patients in those 15 minutes for PCPs and let's see more patients, or 10 minutes now because you don't have to look at the computer, or 7 minutes or whatever that is, right? So do you fear for that? And how do you safeguard
I
against?
do have some concerns, yes. So far, it does not seem like it's happened yet, but I don't it doesn't seem like in any health system they've expected physicians to see more patients because of the AI tools so far. But it's always possible with the perverse incentives that sometimes the healthcare system is facing or certain organizations might be facing. It does worry me that that is a possibility. And I think that's where we're dealing with that complex balance. I think over the last generation, healthcare, I think physicians really just focused on clinical care, and healthcare really fell into the hands of the corporate organizations and the business side of things, and physicians really lost their say in it in a significant way. I think that's starting to change today with more physicians getting MBAs, more physicians taking leadership positions, steering these healthcare organizations. And it really makes a difference. I think some of the best hospitals we have are physician run or with significant physician leadership. And I think that makes a difference. So I think there will be a pushback. I think it's possible that some systems will push for it, but we'll see if it actually happens. I mean, how much can you really reduce the time from 15 minutes? Theoretically, you could do 10, but I don't know if anyone wants to do that. One thing I think health systems have started to understand is burnout is an issue, employee turnover is an issue. So I think if they recognize that, they'll recognize 10-minute appointments is not the answer because then you're losing money on burnout and turnover and all those things.
Yeah, great point. And sometimes hear some cynical statements about the change in culture of work in the new generation of physicians coming in. But what I've seen in my last role, I did a lot of physician nursing hires. And what I've seen is people who are just coming out of training, they have a better handle on their work-life balance than when I finished my training in 2014 had. But they are much more ready for getting in the fight to do the right thing by the patient, and they're ready on day one. They're ready before they start their first job, which is also, I think, some of the work you're doing, but it's really encouraging to see that and that level of motivation and that level of willingness to get into that fight and get into those discussions to build a better system.
Yeah, and I think, that's a product of the times and situation. We've seen how bad it's gotten for physicians and in terms of the corporatization of healthcare. So I think pretty much everyone today recognizes that a change needs to happen. You see it with unionization across hospitals and healthcare organizations. Residencies are starting to unionize residents at different places. I think that's a huge thing because there needs to be a healthy pushback. Obviously, the previous generations of residency training was not healthy or sustainable for anyone. That's not a healthy way to train. It was really just often it's a toxic culture that continues to get pushed on because, well, we went through this, so you should too. And that at some point that cycle has to break. And I think people today are willing to push back because they understand that they're willing to push back and fight for their patients and themselves because ultimately the larger system doesn't always have the best interests in mind. They're looking at other incentives. So it's like when you push back, you are able to fight for your patients.
That's really well said, because I think even when the previous generations who are still working, and I guess I'm part of it, is when sometimes people by just default, if they're really motivated, would have to go above and beyond. And a lot of times at the cost of their own sustainability within the field or just burnout. And I think even keeping track of yourself and what you need out of that work and is a huge way of making sure you can contribute long term. If we had young physicians or residents and fellows, not everybody's going to get an MBA. How do you recommend people educate themselves about the business of healthcare and just be more aware about how healthcare works beyond your patient physician interaction?
I think ultimately be curious, right? You are a doctor, you know the medicine, and you are seeing these patients firsthand. And there's no doctor that can avoid dealing with the system. You're dealing with insurances, you're dealing with your hospital, you're dealing with billing, you're dealing with all these things. So just be curious, explore things. If they don't make sense, ask someone, look into it a little further. There's no need to get a whole MBA if you don't want to, but there's so much information available, whether through books or even just YouTube videos. There's a lot of great people out there. You could just sign up for their newsletters like Healthcare Huddle by Jared Deshevsky, or you can look at Nikhil Krishnan also has Out of Pocket, and there's a lot of different ones that you can just follow, and you can learn a ton about the healthcare system without getting all bogged up in doing a whole MBA.
How about if a physician is scared about getting into the AI, it doesn't get it, I think you did have a post recently on LinkedIn, I believe, on this exact topic about how do you start educating yourself on AI and maybe testing a few things or using a few things.
Definitely. I get this question a lot. I think two ways to go about it. One, just start using some of the tools you hear about out there. There's no learning you'll do better than just using them. Tools like Open Evidence or now Up to Date release their own AI tools. Just start using some of these tools and you'll get a good idea of it. Use tools like ChatGPT and other things. Whether you want to use them in your clinical care or not, that's up to you, but just try to use them in your day-to-day life. And there's no better way to gauge what the limitations and the strengths of these systems are rather than actually using them. The rest is all theory. And it's important you can understand how these tools work, which there's great courses on Coursera that you can do for basically free, whether there's AI for Everyone on Coursera, which is a very beginner-friendly course, just teaches you that core fundamentals. Google has a course that's also free. It's AI in healthcare, also on Coursera. Another course you could also do is Stanford's AI in healthcare specialization, which is also on Coursera. That one's a little bit more in-depth and thorough, but the AI for Everyone is the most beginner level. But even the AI for healthcare specialization by Stanford is very accessible for any physician to do.
Right.
And so I did do the board certification from the American Board of Artificial Intelligence in Medicine.
And has that been helpful in your work?
Yeah, they offer an intro level and an advanced level course as well, just to really help educate physicians as well as, and then you take the exam to get your board certification. But the course is fantastic. The people running it are fantastic, and it really builds a great community of clinicians interested in healthcare.
Okay, that brings us to our last question. I want to talk to you about your book. So tell us a little bit about your book, Trauma Transformed. What inspired you to write it? And if you can tell us a little bit about the book itself.
Yeah, so the book I've been working on the last several years is related to a lot of what my research is on, which is more PTSD, trauma, resilience. And so I really wanted to distill down that information from the research side into a book that's accessible for the general public. It's more so an informational book to take someone through, whether it's someone that has PTSD or major trauma, or a therapist or a physician, or someone who's just curious intellectually about learning it, on how trauma works, what it is, like how you can identify it, what the symptoms are, what's actually happening in our brain and body when we have those symptoms, rather than it just feeling like this mysterious thing, really demystifying like what's going on. And then what we have as evidence-based treatments for those things and how we can understand those treatments. So the core framework focuses on the idea that all recovery from trauma happens through this 4-stage process that we present in the book. And the core process is how we break down the treatments for trauma.
Who are some of the authors you would recommend for anybody who is a physician or even a person who's not in healthcare to read about trauma?
Well, I think there's a great book out there that almost everyone's heard of, The Body Keeps the Score by Bessel van der Kolk. It's a great book. I think it definitely really brought to the forefront of the public imagination some of the key ideas about trauma and how it's not just a mental experience. It gets encapsulated in the body. And there's a lot of ways in which treatment can progress with using body-based practices that really help break down that dissociation and that out of body type experience and bring you back into the body to heal what trauma has encapsulated into it. I think that's a fantastic book that I think most people that are interested in trauma have either heard of or should definitely read. So I think that's one of my favorites that I would recommend.
Great. Thank you so much, Bhargav. It's been a pleasure chatting with you, following your work on LinkedIn. And I know you're doing many things. I think you mentioned now you're writing 2 books, one on AI and healthcare, and obviously a book on trauma. So we look forward to reading those once they are out. And thank you so much for your time.
Absolutely. It was a pleasure. Thanks for having me.